And when you get rid of the healthcare fiasco that it is, and the less we get government involved in this, the better off we're all gonna be. And that's the bottom line of this. And so, but you go on Fox, and I'm gonna get to you in just a second.
Okay.
You go on Fox, and they will absolutely, they'll go through all this stuff, and they'll get experts in there, and they'll argue back and forth and about some line about section 101 something, and this says retained annual income lifetime benefits. In other words, what this all says is that this is Obamacare. There's some stuff about Obamacare that's popular, and so we're going to keep all the popular stuff. There's some stuff that we don't like, so we're going to get rid of the stuff that we don't like, and we're just going to keep the popular stuff. But let me tell you something. Who knows who Snooki is?
You know what?
Who Snooki is?
Snooki?
We have a Snooki fan back.
No,
How about,
don't say that.
No, don't say that. I'm good with you there. So, but Snooki is the biggest piece of trash you've ever seen in your life, and she's on Jersey Shore. Okay, and people follow her life and watch what kind of trash stuff she gets into. She is popular. She's just as dumb as a rock, but she is popular. Okay, Bruce Jenner or whatever he goes by now, that sucker is popular. His wife, Kardashian, somebody, those folks are popular. Okay, popular does not mean it's good or right. Okay, so all this stuff may be popular, like let's say keeping your
Insurance.
let's say it's
26.
pre-existing conditions. Okay, I have MS. Okay, I walk with this. I'm currently disabled because of it. 20 years ago, when I started practicing medicine in Athens, Texas, I bought a policy for disability. I paid for it for 20 years. I don't remember what my premium was. It's over $1,000. I bet I paid a bunch. Now that I'm disabled, they pay me. I bought insurance before it happened. If you buy insurance, if you try to say, okay, right now, if I went to the insurance company and said, I want a disability policy, they would laugh at me. If your house burns down and you go up to the insurance person and say, hey man, I want to buy fire insurance for my house, they're going to laugh at you because it's not insurance, it's a certainty. Okay, you're not insured. So when they keep that in there, what they're saying is that we're going to take everybody in here and we're going to pay for their health care. We're not buying insurance because insurance, you insure a risk. You don't insure a certainty. And so when you say pre-existing conditions, everybody likes that. Oh, it sounds like a great idea. The problem is the horse is already out of the barn's already burned down, somebody's already got the disease, they're like, so you can't insure a certainty. You insure against risks. And so we've got to get our words right, but if you go talk, and I had this, and I'm sure Ted's had this problem, when you talk to people in government, they think that health insurance and health care are the same thing, and they're absolutely 100% not the same thing. But it allows folks, and getting lost in the weeds allows people to pull the wool over our eyes, and we ought to be smart enough not to get the wool pulled over our eyes and just say, listen guys, let's make it simple where we can understand it, because if I'm doing something to anybody in here, if I can't explain it to you in 10 minutes what I'm going to do to you and draw you a little picture of what I'm going to do and that kind of thing and why you need it and why you don't need it, I'm not a very good doctor. I'm just not. And so, and if politicians can't explain something better than this, you ought to look at them and say, I'm not voting for you. Okay, period, end of statement. And so when we start repealing things and getting our government simplified, then we can say, okay, that's the kind of guy I'm going to vote for. He's going to make things simpler where we can all understand it, because smart people can make things hard, complex is simple. People are trying to pull over the wool over your eyes. They do the exact opposite. They try to make very simple things very complex where they can just snow right over the top of you, and that's how government works. Am I lying? No, I'm not.
No.
Yeah, all right. Yeah, you're lying. So, okay. All right. Oh, you had something. I'm so sorry. I'll get back to you.
Well,
I'm going to take about 2 questions after this because I don't want to go real long. I want to leave a little bit of time afterwards. You'll get one, and then there's your 3 right there. So.
Okay.
Yes.
I know people, they get to the age, they have to have some kind of coverage or they were going to be penalized. And so they get Medicare. They kind of quit trying the natural healthy on some people that I know. One's a relative, another one runs an organization with me. And talking to both of these women, and I'm curious if this is like across the board, when you get government, do they make it where doctors have to make every woman a certain age do this? Because they're all like on a diuretic, but they don't need it. And they don't question it. Is that there's certain tests to get to the next step, but am I making sense?
You are, absolutely. And what you're getting to, let me give you what I see from my side of it. When they came up with Obamacare, one of the biggest things in it was that you had to have an electronic health record. One of the biggest parts of it was EHRs. there is a carrot and stick here. We'll give you a little bit of money up front if you implement the electronic health record. And if you don't do it after a few years, we'll give you a little less. And so we really, really, really want you to have an electronic health record, because then the feds can go in and they can look and they can say, okay, well, you've got 500 patients miss primary care doctor. My wife's a primary care doctor. And so, you know, you've got 500 patients. Your average blood pressure is 120, or let's say 131 over 81. And each one of those numbers, so it's got to be under 130 over 80, and you're one over on both those. We're going to fine you for that. Wow. And so all the doctors, you know, my wife or whoever that primary care physician is going to say, okay, well, I'm going to treat everybody's blood pressure to below that, so they get it down there. The problem with that is some people don't tolerate a low blood pressure. Yep. Exactly. Some people, if they stand up, if they're on too many medications, I saw it, some guy fainted in my office, and he was on way too many blood pressure medicines. And he fainted. I put him down, put his feet back up, and he's like, great, and walked off and did fine. And it happens to my wife all the time. She does cardiac rehab, and they over-medicate those guys. And so some people need a higher blood pressure so they can stand up and not faint. And that is best determined, in my opinion, by the doctor and the patient. Not by some bureaucrat sitting in Washington or Austin or someplace else saying, I'm sorry, but you didn't meet this criteria, so you don't get that. And that's why those folks are on there. It's like, well, if they're above this age, they've ever had congestive heart failure in their life, they got to be on a diuretic, period. And if they're not, then they'll call the doctor. They call me and say, oh, this patient, you know, they need to be on a diuretic. This patient didn't get this. This patient didn't get this. And I'm like, who's the doctor here? Are you or me? And they bring big financial penalties, and then the hospital comes and gets on
To
it.
you?
Yes. Yeah. Medicare will say, oh yeah, no, we're not going to pay for that, because that's poor quality. As defined by them, not as defined by you and the patient. It's not about me and you, you know, making a deal and saying, I'll take care of you, and you pay me $25 a month and I'll take care of you. It's not about that anymore. It's all about they're paying, so they're demanding quality. And how they define quality is not whether you live or die, whether you faint when you stand up or not. It's how well those numbers look on a piece of paper. And that's it. And that's all they care about. They don't care about anything else. So, yes.
The question is that we keep hearing all this about buying insurance across state lines.
Mm-hmm.
I see 50 problems because there's 50 states, and I see probably 10,000 other problems because there's insurance companies. And I have never done a study, but I'm assuming is that there are probably less than one of the 50 states that control who can sell insurance in their state and take cross state lines. And so, you know, to me is that, you know, it sounds good, but I'm not sure it's ever going to happen, because of the fact is that state insurance agencies control a lot of power, and you know, I really question it, and I'm looking to see what, you know, how's it going to happen?
Two issues there. One of them is, how much should the states be regulating each insurance agency?
Right, that's what I'm saying.
I think that's honestly both of that. That's the heart of the matter. Is how much are they going to regulate them? Because you're right. Right now, it's a pretty regulated industry, and there's 50 different states and 50 different laws. And if you start trying to sell something from Texas and some guy in Rhode Island that's offering the best policy, then a lot of people are going to buy it from Rhode Island. And you know, if it goes bad, then you're going to call some regulator in Rhode Island and that kind of thing. That's a mess. But that's, again, we're dealing with third-party payments, which led me to something I think you asked earlier about if there's doctors that'll take care of you for $25 or $1,000 or whatever else. Honestly, I think that's kind of where I call that black market medicine, because it's kind of when things are too expensive on the real world. And Clint's, I think, a little bit of a libertarian expert on kind of some of this stuff. You know, that if we outlaw alcohol, people are going to get on the black market. They start. You know, if we tax cigarettes too much, people are going to do it on the black market. So if there's a market out there, people are going to do it. I think there's a market for healthcare, and people are frustrated, they're tired, and they're looking and going, this stinks. This is horrible. So there are practices out there, and there's some in the state of Texas, and I know some of the people that do some of them, that they'll charge you $100 a month, and they'll show up on a number. Say, here, I'll see you. You have a problem, you give me a call. Here's my office. I want to see you twice a year. I'll write your prescription. Come in. I take your blood pressure instead of having a nurse take your blood pressure. You pay me $100, I have one receptionist, and so I pay one other person. And so the cost of your healthcare, and I'll take your blood pressure and check your labs and do whatever else, and then write your prescription for 6 months, you go away, you gave me money, you're happy with your service, I'm happy because I got $100 and I don't have to share with a bunch of people. So that's what I call black market medicine, and I think that's what's gonna happen. I think from that, you should have a catastrophic policy, so if you get cancer, you get, but the other thing I really think needs to happen is if you get cancer and it's just say, okay, well, your insurance company pays you $300,000, and says, okay, you got colon cancer, here's $300,000. You'd find places the places, MD Anderson or, Baylor Health System or Scott White or whoever, they would come up and say, okay, well, we'll treat your colon cancer for $250,000. And they would then, the other guy would say, okay, well, we'll do it for $260, but we'll give you this, you get private. So, I mean, they would compete for you. And right now, when they're paying somebody else, you're hoping that they pay them. But I think your insurance contract ought to be between you and your insurance provider, not between me, you, and 2 or 3 other people and your insurance provider and everybody else is kind of shuffling papers. So I call that black market, and I think that's what's gonna end up happening. And I think the government's gonna do their darn level best to try to prevent that from happening so that they can't sit there and regulate everything. So I had one other question.